Hey guys, my name is Barry. I'm Sam.
I'm Marie.
I'm Ajit.
I'm Noah.
I'm Maria. I'm Madison. I'm Nada. I'm Pearl.
I'm Prakash. I'm Vishnu. I'm Ari. I'm Vishal. I'm Walter.
I'm Simia. Kylie. I'm Joanna. I'm Drusilla. I'm Mariva.
I'm Neil. I'm Adam.
I'm Samarish.
I'm Sona.
That's Nate.
I'm Nate. I'm Nate. Okay, very cool. Now we're gonna get into, yes.
And we got Caitlin joining virtually. That's
I get it. So now we're gonna split into a team of two, and I will number us off. And so when I say number one, so 1, 2, 1. You don't count. I'm giving Noah 2 to be a person for Caitlin. 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1. And then Ajit and I will be facilitators of this little group. So what we're gonna do is I'm going to read the instructions. Ajit and I are these people holding up this blanket. It's actually my couch cover. If you in my house, they'll recognize it. And so what we're gonna do is that each team will put someone forward that the other team won't be able to see. And so when Ajit and I lower the blanket or my couch cover, the first team to say the other person's name gets that point. So it is a forced way for us to learn each other's names. We think learning names are important. Any thoughts, comments, Adam?
I disagree.
Oh, fine, just kidding. No violence here.
Community building.
Community building. All right, so can I have 1's over here and 2's over here?
There's Jonathan.
All right. I don't.
Yeah, we don't need to share right now. Okay, recording. Yeah, this is awkward. It's gonna be on the recording.
It is what it is.
No, you can join.
It's hard to do it.
You always do.
Like his third, want to get my couch cover? Oh, I'm just gonna be like, it's pretty thick, so I only have a little All right, here we go. So, it is in your best interest. You're missing out on some hot tips from yours truly. So it's in your best interest to figure out this order that you're going to put yourselves in without the other team looking. So don't make it obvious and don't say anyone's name, so who's going to be up out loud. You'll be surprised. All right, so the other thing is, you guys want to get on the ground. You want to be on the ground. Okay, you guys are over here. Friends, I am asking for your attention. So it's going to be in your best interest to be on the ground.
They're crouching and therefore.
So I guess together. So what you're going to do, okay, wait, here, I'll give you some more tips and tricks. So you're going to do, crouch, try to sit or crouch, and then what's going to happen?
It's actually so
So
nice.
so then if your person who's in the hot seat doesn't know the person's name, it should be like a whole form of that situation. We'll cross up
Oh, this person was in that group.
I'm sorry. No, you see, not yeah, it is. Like, you guys get low.
I would suggest getting on the ground and start deciding on someone to go forward. Also, if you don't, I would scooch together so they can't see who's on the edges.
Yeah, I'm not a very big person. I can't really talk.
Okay, why was wrong with that statement? If you said her name, the other team might hear you. Say her name.
Oh, yeah.
See what?
Strategy. Come
Oh, yeah, right.
on, go.
Okay. You guys, I'm gonna count to 3. It's very complicated on both sides. Anyways, I'm gonna count to 3, and on 3, you're gonna drop it, and then your team can't comment. Again, it's not a team sport. So then you have to name this person's name, and this person has to name this person's name. Okay? Is everyone on board? Yes? Okay. 1, 2, 3.
I should totally know your name. I feel like Shannon. Grace. Sharon. Abby. What's the best? I think. Sierra. No, it's not Sierra.
You can help each other out if you want. I think at this point, neither team is getting up.
Okay. So she can help me?
Yeah, you can help each other. Help
Oh,
each
like if
other.
I'm getting warm?
Yeah, okay, let's do
Okay,
the thing if you're getting warm.
Like if I'm getting warm or not? Okay.
So,
I feel like it makes sense with an A.
you can try that the first letter. Yeah, you have first letter.
Oh,
That's
that's
specific.
easy. That's easy. Okay, how many letters is your name?
6.
5, okay.
Oh,
Okay, sorry. That's too easy.
No,
no, just give her the first letter.
I almost said your name. That's it.
Eyes.
Okay.
Okay.
Yeah.
Okay, yeah.
Carol. What's the first letter of your name?
Okay.
Okay. Can you give another hint for Irene, for our friend Irene?
Yeah.
Oh,
This is just what's down.
A.
Is there anything else that rhymes with it?
Literally like nothing.
Well, then make up a word.
The last two are E's.
E?
Yeah, both sides two E's.
Irene, do you want to phone a friend?
Somebody knows? Kaylee.
Kylie.
Oh,
I think you get a point just for Irene was so confident she leaned in. We should know. We
Does
know.
everyone know Irene and Kylie now?
Yeah.
Okay, perfect. This is like a half a point. We're gonna have a point.
All right.
Maybe
0.25.
No, sorry, Irene. Okay.
Choose your next fighter.
All right, choose your next fighter, friends. No.
I mean, the top point's 0.
Also, I would scooch in yet
Yeah,
again.
get
I'm
narrow.
telling you to get narrow so that they can't see
You don't have to
who
worry
is already out. Who hasn't gone yet? Are you guys strength numbers? Oh, man.
Wide is better than tall.
Well, I think wide is better than tall, but you don't.
Okay. Oh, neither of them.
Ready? 1, 2, 3.
Oh, good one.
Oh, that was
That's tough.
fast.
That's tough.
Just team. Does everyone hear their name? Everyone can identify? Naga?
Joanna.
Joanna. Yes?
Yep.
I want information. Literally anyone. Or like you.
Folks, who's this?
Perfect.
Well done, class.
Yay.
Next fighter.
Now it's 1, 2, 2.5.
I don't like why. This feels weird. You know, this seems like I think it's fine.
I think you're gonna make us proud. I hope so.
Say name.
Hey, we see you working.
We saw that.
Maybe if you guys were like, maybe like a little bit more like.
Perfect. I'll go with the outside right now. Just like so they
Well,
can.
you saw me once already.
Yeah. Just a thought. Like.
You don't get it.
On silence.
All right.
Adam.
Why are we saying his name? Okay.
Okay. 1, 2, 3.
Maria.
Ooh.
That's really tight. I'm gonna go.
I think we got it. I think we got it.
You had better pronunciation, but she got there. Oh, that's true. Wait, but that gives Maria the advantage.
Yeah, I win.
It sounds to me.
Yeah.
like-
Woo!
Yeah, I think.
It was a split second decision. It's really
Both
time.
of us should get points. No, that's not.
That's not how it works.
Yeah, but
Oh.
these are a little biased.
Do we know the names though? That's what really matters at the end
Alright,
of the day.
so Ariba and
Wait,
Maria.
bias. I'm always biased against Maria. That's the one rule. So if you chose her,
Okay,
It's not
wait,
gonna buy
back to the point of the game. Everyone can identify Ariba. Everyone can identify Maria. Yes? Can I get a, okay.
can you say the names? That's not the battle.
Ariba.
Arriba? Okay, cool.
All right, well, I think we're gonna, they got a point for that one. It's 1.5 to 1.
Type.
All right, choose your fighters. Is it going over here?
She keeps trying to watching you do that. That's fact. You keep trying to look.
I'm so sorry.
I did
I'll move back now.
Okay, all right,
Oh,
you
this is
guys,
good.
you guys ready? 1, 2, 3.
Sabri.
Oh.
He had a long way to go.
Okay, that was clearly like.
But that was clearly a win. Welcome to both of you.
What's up with this bias?
All right, everyone can identify name. Yes, say it, wait for people.
What is it?
What is his name?
Name.
Perfect. What
I don't
is
buy
the
it.
individual's name?
Sabarish.
Perfect.
It's an individual.
Individual.
Individual. Okay.
Okay. Who's next? I would also recommend lining your people up so we can get this moving a little bit faster. So start thinking about who you want to go next, so we can keep this flowing. I'll start enunciating things
All right,
stronger.
let's get a countdown.
1, 2, 3.
Oh, gosh. Ara. Orient.
Identify her.
Simia. Okay, this is Simia. Wave to people. And your name is Aryan, right? Aryan. Can everyone say Aryan with me? Aryan, Aryan. Perfect.
Okay.
2.5, 2.5, 2. Because I got Nate. You got Nate. Don't question my sparking.
You're right, you're right.
Okay. Hey, who's up over here? Come on. Sorry, that was a little. My mom calmed down for a second. Sorry, that was my mom.
Bring her back.
Anyways, 1, 2, 3.
Akash.
We locked it down. Did you get anything out there? You're pretty forceful with that in here. Is it Varun?
That's Vishnu.
Clear
Alright,
point.
so it was close.
Close, it was close.
Alright, who you name Shalika? So this is, what's your name?
Vishnu.
Vishnu, I don't remember that one now. Vishnu, and what's your name?
Akash.
Akash. Everyone identify Akash real quick? Oh, Vishnu, Akash. Okay,
Excellent.
put your fighters up. I'm gonna do contestants. I'm good friends.
We get a score update and then.
Oh, score update.
It's 2.5 to 3.
3, 2.5.
That was a test for you.
No.
Good thing Jonathan's helping.
Okay.
Okay, 1, 2, 3.
Here's a. Where was this dedication during?
Is that official?
Can we get a confirmation on your name, sir?
Oh, Rashawn.
Rashawn?
Rashawn.
Rashawn with a V.
With the V.
Okay.
All right,
Next fighter.
next friend, next contestant. Next
Oh,
participant.
these people hate each other. Right.
Okay, 1, 2, 3.
Chipra.
Nice. 3.5 to 4.
Before you know his name?
No, sorry, what's your name?
Sam.
There.
Sam, Chipura. Has everyone got that? Okay.
Yeah, I'm like,
I can see everybody from over there.
no, John was
Why are you sabotaging us?
because you're spreading out.
All right. Who's next? Okay, ready? 1, 2, 3.
Frog off.
Yeah, get me.
You're a guest.
No,
I'm just kidding.
no.
Sorry. You're fine. I'm doing
We got Raga and Sona.
Raga. So.
Yeah.
All right, 3.5 guys, come on.
Let's go.
Come on.
Okay.
Wow.
Okay, 1, 2, 3.
Neil.
Madison.
Yeah.
Wait, I think my hip help.
Everyone identify Madison. Say hi to Madison. Madison, that's Neil. Everyone know who Neil is? Perfect. Okay. All right, who's next? All right.
Yeah. Strategy. Yeah. Damn, you're doing really well.
That's a strategy.
All right. 1, 2, 3.
I'll try to get something out there.
Yeah.
Out of all the names you could get your own.
No, we
We have a new fighter. All right, guys, I'm not sure what to do.
If you have someone new, send them up.
Nate, go. Yeah, Nate, come on.
Thanks, Tom.
Yeah, there you go. That's the stretch.
I can't see this.
All right, this is game exciting. All right, you guys ready? 1, 2, 3.
No, you said stand up somebody new, we just figured out who wasn't there. So nobody was cheating.
Yeah, that's fair.
Want to round us out?
Yeah,
I was like,
I think
I don't-
this is the end of our game. Hope you guys enjoyed that. Hope you know each other's names a little bit more. My little note at the end, my quick word is that names take time, and I am not good at them sometimes. And I just ask that we. Okay.
Just keep working on names, guys.
Yeah, that was
together
my
here. We could.
You want to do this again at the end of the year? At the end of the
Yeah.
semester? See how much faster we can be?
We should do it.
Okay. Is that cool with everyone?
That was great. So from there, we're moving on to our GHU. So get comfortable. Feel free to stay on the ground, move to a chair. Sit around Neil, away from Neil. And what you want.
You know, cheating.
That might be mine.
Okay, I don't think I need this. Can you all hear me?
Yeah.
Perfect. I'm very loud. Okay, so today's our first internal GHU, that's our committee minus outreaches. And we're gonna be presenting about public health, because that's what women's about. And it's just gonna be really short, the actual presentation, so you don't get bored. But the actual GHU is more gonna be your part, and have like group activities and stuff, so hope you look forward to that. All right, let's go. So what is public health? And with a show of hands, who knows what public health is? All right, show of hands, does anybody know what we can tell about public health? Go ahead.
Woo, okay, so public health, I feel like has a lot of definitions, so nobody get overwhelmed with one or the other.
Yeah, there's
And
no-
yeah, whether or not it's like super eloquent and whatever, right? So I think in my eyes, public health is just like the intersections of all the underlying like health issues that exist. My glasses are getting blurry, sorry. But that's just gonna be my quick definition, because I would love to hear more.
Yeah, please, anybody, there's no real answer, the one I got is off of Google, okay, so, doesn't really matter. Something, anyway, what do you guys think public health is, what does it mean to you guys? Go ahead.
Health affects like everyone. And it's.
Yeah,
Perfect, yeah.
nice.
All right, the one that Google says is public health is defined as the science of protecting the safety and improving the health of the community through education, policy making, research for disease and injury prevention. Education part is what we're trying to do right now. Something else, what is? So what is like the goal of public health? And the underlying mission of public health is to improve health of all people. So what do you guys think health is? Sorry, somebody raised their hand.
Not the absence of
I mean, yeah, absence of,
absence of disease, like the disease.
okay, yeah, and yeah,
Like your physical and mental well-being.
physical and mental well-being. But on top of that, when we're talking about public health, it also includes access to resources, access to education, access to living conditions. All these are considered come under the big giant umbrella of public health. So that mission includes not only the practice of public health policy, but the research of public health issues, the education of future leaders who will eventually translate that research to practice and policies to improve the health of people regionally and nationally. Oh. Public health initiatives help keep people alive. In the last so many years, so 100 ago. These are the three that we've mostly been focused on, and we've made two good progress. One is increasing life expectancy. Reduction in worldwide child mortality, which is really, really big because back just 100 years ago, more than like 25% of children born in the US alone didn't make it past the first one. Now, almost about 87 or 88% of the children are making it, which is a huge improvement. And other countries have a little issue with that, but it's getting better all around the world. Especially since the invention of formula. The eradication or reduction of many communicable diseases, you guys know, vaccines, treatments, etc. Right?
I'm gonna use the mic because it's fun. So I'm gonna talk about how government plays a role in the public health in the world. I think the place to start with that is what their mission is. And at its basis is that we want to improve the health of everyone in the world. We want to have a world where people can thrive, not just survive. We want to do this by decreasing marginalization and the effects of colonialism. One of our main values is that health is a human right. Everyone should be able to have solid physical, mental, and social well-being, and have access to facilities and services that allow them to achieve that. And the way government does this is by improving community health, and do this in two main ways. One of them is our sustainable partnership model. I'll talk about that in a second as well. Our partner SAW, basically we partner up with organizations that we know have a lasting impact on it. And the other way, the less thought of way, is the discussion and education by our community members. We're able to educate with each other. Many of our GHUs will be applicable to your real life. For example, 2 years ago we had a GHU on sleep. I know I'm never going to forget that. Sleep is very important. Right. Let's talk about how SAW plays a role in public health. So SAW, as you guys hopefully know, is our international partner. They are the social action for children and women, and they have lots of services. The one we play a role in the most, and one where our fundraising money goes to, is the Community Health Outreach Program, or CHOP. This is where they educate people in health aspects to help them spread educational knowledge and health and stuff to their communities. SAW also has lots of other services that help with their community health and issues. So things such as the healthcare house, which provides retroviral treatment for children and women who have HIV and similar diseases. There's also youth shelters and migrant learning centers, which promote education and give people housing to live in. And of course, there's also the Income Generation Program. This is a feeling of job security for a lot of people there. And I know some of these things don't really seem like they're affecting public health directly, but you'll see in our discussion questions, there's something called the social determinants of health. We just wanted to introduce that we have one of our other GHs in the future, so stay tuned. And our other partner, our new local partner, is Witness Anchor. They want to break the cycles of poverty and addiction in their communities. And they do this by helping out women who are victims of trafficking and substance abuse, by giving them housing, residence, and adjustment to space. Right. So now we're going to shift to some breakout rooms. For our presentation.
Yeah,
Stay
this
tuned.
is as far as we go. But you guys, before we start, do you guys have any questions? Comments? No? So there's some of the breakout rooms. The first one is current public health issues.
Well, actually,
What?
yeah.
We need to keep documents.
Oh, yeah. So we'll be pairing you up with a keyboard member. Just saying, they have a laptop. we have usually for breakout rooms, we have a series of questions. If you're in the last meeting, not really seen that. But we're just going to remember they're showing on your laptop. And you guys can start discussing.
Do you want to click through shows with this room? Actually,
No, that's.
We do have time. Yeah.
So you guys can just go ahead and.
We'll count each other
I'll
on.
count it out.
Just so keyboard members.
Okay,
We're just like, say you work don't count.
yeah, you were done. All right.
So,
So let's give it-
thanks, Terry. 2,
Oh, 6,
yes,
3,
4.
5.
3,
1.
1.
Oh, sorry.
6.
So, wait, was it 1?
All right, all ones, 2, 3, 4, so 1, 2, go by, just kind of.
One's over there. 2's over
2,
here.
3, 4, 5, 6. Keyboard members find this through this one here. Where is it right now?
You remember?
One.
Sam, right?
Yeah.
Sorry.
On 13. You? In what major? Okay. I transferred it last year. I didn't do first year. It's good.
So this is like your first year.
This is my second year, so my first year.
There's something else coming up.
I'm struggling with it.
It's easier.
All right, you guys got like 7 to 10 minutes. Big logo and blue.
We asked the discussion questions individual. Not the group.
Our program, yeah, the discussion is guys, but you can do the best
You qualify like breast cancer, that type of stuff. This is
More like, I mean, I guess it's more health a little bit, but for me, like, if you can't spread it to someone else, it's not as much public health. I can't remember what the word is.
Something you can do to like prevent.
Yes. I guess you could say.
Like you could consider staying.
No, it'll be in the cookie apparently, but it's also in the notes.
If you were able to do the notes on the breakout documents, it would pull up and show the video possibly all the notes, right? So I'm gonna like. I just thought it would be easier if Joanna was able to do that. Like I don't know if I was gonna mess with the recording or not. Or maybe my laptop.
It's not been like this, guys. I've like all weekend study for opens, like people are looking for me.
I took my chemistry. Yeah. That was awesome. It was actually way better than taking it first because some of the exams were proper. So it's just like okay, so cameras open and
Is there only one virtual member?
yes. Okay. Is everybody like to each their own? I thought bio was harder because I took it at the same time. So I thought bio was harder.
Maybe like all three.
Yeah.
It's
Skin cancer.
Obesity, infant mortality. Yeah, smoking.
I feel like heart disease, yeah, that's a big
Heart
one.
disease.
I'm trying to remember, we've learned these before. I'm like,
How's it going? What are we up to? Oh, just types of public health issues? Is this what we're going for? Yes.
I didn't.
Can I see the breakout room? It should be in the group.
I just checked the they just said that. He's like, oh, send in the chat.
It's okay. I have been there multiple times.
Okay. These are vegetables. Here's the real question. Breakout room, I think.
Two.
Two, okay. Okay, how? One public health breakthrough and one incident during the time period.
This breakout room number 2. And then breakout room number 1, and then we'll start with these questions. It's okay, just
Okay. How do we think services saw and what was Anchor improve the health of their community? Okay, and then we can think about the social determinants of health.
I remember. They exist and it's already really just like and a lot of them when they
So, if we look at Saw,
all those
okay,
dead
well,
shells.
we want to focus on Saw or music.
saw.
Okay. So,
It's like it's like a little boost to that.
that's what it was thinking.
Yeah.
More than you know.
And so how do they help? Shelters. Okay. And Saw help.
Social equality, lack of healthcare.
Saw.
Kids on the perfect. So honestly still gets me sometimes. Like 110% what we do. Okay, so our community health outreach program. Oh, we educate the community. That's a good one.
Okay.
It's like giving them a place to stay.
Is there anything you all think about when you hear the word saw? Like when you hear saw, what's the first thing that comes to your mind? Maybe some of the stuff you've heard in past movies. Anything? I guess.
I think a lot about kids, I guess.
Yeah.
Focus on children, which isn't really public health, but and then I always think of that poster for holding like the.
I feel like you wouldn't know if it's dark this much.
Oh, you're talking about the picture where she's holding the uterus with
Yes.
the chop workshop? Yes.
Yes. So child workshop, that's a good one.
We'll get back to the
Through child workshop.
presentation and, we will, so real quick, about 30 seconds. Kidding, but you know, real quick, one thing that you guys found interesting, that you guys discussed.
The fact that like social things like not having access to healthcare, living in a war environment, not having good nutrition access, being in an unsanitary place, like all the, and just like not having good education, those can all tie to just having health problems.
Very good point. We'll talk about that more in our next YouTube.
All right, you go, number 2, what do you guys got?
talked about how the way that SAW deals with the health issues that they see in their communities through like CHOP workshops and basically education, so that part of like the sustainability model of like helping people learn how to take like public health issues and apply them to themselves and like make themselves as healthy as possible.
Community health is public health.
Good for you, what you got?
We talked about access to resources. We talked about the partners and what they do to help out the public health in their area. So by giving proper education to people, by going to rural areas, remote areas, and also a lot of people cannot have access due to economic issues, and by helping them a little bit, it can help improve the community health care, and that will also slowly but surely in the snowball effect will hopefully help the global one. Okay.
One thing that we found interesting was focusing on the community health in a smaller groups. So you have to focus on yourselves first before you can go out to society as a whole, because you have to make sure you know what people need outside of your area. So you want to test things in your small group first, so you have less risk, and you just want to make sure you're doing it right before you.
So kind of similar to group 4, we were talking about how the importance of focusing on the health of your own community, because you know what's going on in your own backyard. So we found that really interesting.
We really tied in the social determinants of health into what SAW and Wakeless Anchors are doing, and seeing what parts of the social determinants each program is really tackling.
Yeah, it's really great that you guys are all talking about community health, because even though the real public health definition is like, it's like not exactly like community health, the really important thing that GloMed does for like its members, its chapters, and its like partners is to support community health, which in turn will eventually sustain global health.
Exactly, yeah. That was really amazing. All right. There we go. These are some, I did like global and local. So you have local problems in Cincinnati area, which are cardiovascular disease, diabetes. One of them got cut off, but it was motor vehicle or safety. Lung cancer, food deserts is also Cincinnati. You just watch it up. And then malnutrition, infant mortality, HIV/AIDS, and COVID-19 are for our global public health issues. All right, now this is the more fun activity we're gonna do.
Yeah. So stay in your same breakout rooms. Each of you are going to like have like a certain time period for you guys to research it. It's all in the document, but like for each group, they have their own time period. Just find like try to find at least like one public health incident and one public health breakthrough. They can be connected to like just make a collage of pictures for. We have an example on the breakout room notes. So
does anybody which computer?
no.
Basically, each group, you'll know which group number you are, right? 1, 2, 3, 4, 5. Each group is given a time period. The earlier ones are going to be the wider one because not much information about that time. But within the time period, ideally you should come up with one public health issue or problem that was there and its solution if it has been solved since then. You can go ahead. Only request for 2000s, don't pick COVID because we did that. That's our example.
And in the end, you're going to one member of each group is going to be presented back to.
Yeah, so decide who's going to present also back. So be like a quick, you just like a pictorial representation of what happened during that time or what's happening. Should I?
Lock that one.
One that I found, there's a plague in 1665, and then the London fire in 66. Because I guess this website, well, I mean, they're trying to catch it. I'm not sure if we can put it on, but basically, so what our group has is 1600s to 1800s.
1700s to 1800s. Which play you We can honestly put the camera on this part. Sounds open. Oh, okay. See you, Caitlin. Have a good week. It was on the dock.
I tried to find the dog. I was in the wrong.
1660. The idea was that these people were just discovering how germs worked with mice and dirt. And then they believed that the Great Fire in London the year after actually improved it because they had to rebuild. See, it says streets had to be wider, houses were made of stone and brick. So brick houses were warmer and healthier, since we replaced wood houses. So the idea is that because they had to rebuild, they had a better idea for that because they had infrastructure, which is important. Right. Now it's talking about slaughterhouses and how people would still like do that with the city farm. So it helps a little bit, right? People are in warmer places.
I heard about the jungle.
Huh? No, we're not at the jungle. No, it was written about the meat packing in the 1800s. I think the book itself was written in early 1900s. Is that right? Was it 1800s?
I thought it was there's like a book called The Jungle by like Urban
Ulysses. Yeah, The Jungle by Ulysses.
Oh, Ulysses.
Yeah.
It's usually like much earlier than 1800.
It's not.
So this is really about the plague or more about the fire?
This is more about this part here is about the plague. It's just kind of website that goes through like 16th, 17th, and 18th. Which is like 1500s.
Are you talking about the bubonic plague or like?
This is calling it the Great Plague of 1665. And then the London Fire the year after, how it helped. Like the idea is that they had to rebuild things. The streets had to be wider, so there's less, sewage in them.
Like the Romans.
Exactly.
And then we can find a picture of that fire. Throw on there. So like talk about that there was a plague in a sickness, and then we can put like some smiley faces. Or we can put them neutral faces. Let's start with some neutral, and then we can show like I don't know. We're supposed to really focus on one, or we can more.
We're talking about a public health issue and a breakthrough that came out of it, which is a result of
Showing plague.
I think it works. I think it checks out. Good.
Oh my God.
Sorry, I tried to get up without like, but I
Just like that's
sorry.
Okay, so we have someone on their nice stretcher. Please. And then I got you. So now. Even if it's not deep fire, it's still A. So you have 165, pictures of
It doesn't work fire.
So I do my
What do you guys pick?
They 1665, and then the breakthrough is that there was a big fire where they had to like update a bunch of health regulations.
Yeah, they rebuilt like the city basically, so because the fires and everything down, I think they had to build wider streets and brick houses, like tin and stone roofs. So it helped like be a warmer place, even though that sewage wasn't really fixed by that, because it was wider, people had less of it to go through, so even in itself helped kind of decrease a little bit. So it's an interesting break that they finally started discovering the germ theory disease around this time.
Yeah, wasn't it cool that?
We die.
Okay, and then I'm gonna put on, so this is like, which is before, is what I'm going for. After, to be like, maybe some pictures. It was not, like, I'm just trying to figure out, I don't know why it's talking about okay, then now, on here.
All right, everyone, this is your 5-minute warning. We'll start wrapping up and begin our little main presentation at 7:35. Hey guys, all right, 5-minute warning. Get ready to start presenting and finish up your little presentations. Remember to choose someone to present back to the main group. Right? The microphone.
You muted? We on live? We on the air? Oh, cool. Yeah. Is it picking at me right now? Yeah, it is. It is. Sorry, continue. Go on.
Now there's a back.
What if I just did that? We could argue like them redoing it like that, like bigger streets and stuff, right?
Yeah, we can do that. We should also mention how wider streets like allow people to physically space out more, not spread.
We're gonna argue that this is rebuilt London. I don't know what time it's actually.
It is. They don't know. They don't know.
I don't know.
If you say with enough confidence, they absolutely will. But like the skyline of Cincinnati. Yeah. They put in a giant freeway. This is the London street.
I tried to look up Cincinnati in 1667. They're not.
Cincinnati was nothing.
That might be why. I don't know. It wasn't. Yeah, I didn't think about that very hard, did I? How about we say original Cincinnati? My search is freaking like. If I just put like
I think we should put a picture of a freeway. Yeah, be like, look at all the wide streets. Like,
I just did freeway instead of like. I probably should have. Here we go. This one is the streets of London in 1660. Hope you guys don't like share. I like have no. As for next week, I'll be very ready.
We start. No one's gonna give us some of our say our virtual norms.
Right, okay, so just real quick before we go back into a breakout room discussion, I figured one of the norms we should go over, there are multiple norms, so there's an e-board member in every group that can like kind of reiterate this as well, or add other ones that they think are important. But the most important one that I think right now is the permission to be raggedy. So obviously we have done research, we've only done research for a few minutes. It's okay if you haven't thought everything completely out or you misstep. So I just wanted everyone to know in this room that you have permission to, I don't know, backtrack a little bit or say you don't know where something's going to end up. Just try to go through and be okay with it if your sentences are exactly clean and eloquent. So yeah, with that, we can get started with group one. Does anybody have any questions about permission to be raggedy? Any comments about permission to be raggedy?
Say their names and what it's not.
Yeah, another norm that is important is everyone should share their names as they share what their group came up with. All right, anything else? Awesome, then I think I'm going to turn it back to Sabarisha Chopra and we can start sharing that.
Yeah, we need to refresh it because all of your. All right. So this is our example thing. I'm sure you guys are doing one. COVID, then working from home, masks, and then vaccine was a big breakthrough, and telehealth was the other big breakthrough for this last couple of years. We'll start with group one. Anybody wants to
So
stand here or?
my name is Vishnu. So we talked about the Black Death, which was pretty big. It was in the 1300s in Europe. It started because, I believe it's because fleas bit rats. So that's why we have Remy and a flea. And then they transmit that disease to humans. And it was really bad, hence the name Black Death, because so many people died. It was so bad that like there's so many dead bodies that really stunk up the place because like there's so many corpses, which is really morbid and stinky. And the doctors, the doctors had to like wear these plague doctor looking costumes with a really long beak. And the reason why that beak is a thing is because they would put like fruits and other smelly, like good smelly stuff, like because Febreze wasn't a thing back then. They would put like fruits and stuff to counteract the horrible smell. And one of the main ways, it was a wrong way of like they tried treating Black Death by doing bloodletting, which was not good because basically the whole premise was they thought the disease was in your blood, and the way to get that disease out was to let the patient bleed a lot, like into a bucket. And a lot of them died because of that, and that just added to the death. But now, thanks to modern technology, we have vaccines and antibodies, which prevent us from going through that again.
All right, so we looked at the plague of 1665. This is going to be pretty straightforward, but there was a plague in London in 1665. And then basically what happened was there's like a giant fire that burned down the entire city. But then if we go to the next slide, they basically took that opportunity to rebuild London. So they built wider streets, they built buildings with brick instead of wood, just things to sort of prevent more fires, things to make the sewage less of an issue. The wider streets also allowed people to like, I guess, social distance more if there was like another communicable disease going around. And the picture on the bottom left is not London, but it gets at the same idea, I guess. So yeah.
Say your name and then. Oh, hi. So my name's. It's the next slide. There's 2 slides. Sorry, it's the next one. A picture.
Wait, does it not update like?
Oh,
Sorry.
Oh.
My bad. We know we're supposed to do pictures, so I'm just kind of adding that last minute.
So okay, yeah.
Sorry.
So my name is Irene, and I'm gonna be talking to you about the Spanish influenza.
Next one.
Yep, there it is. So the Spanish influenza started in 1918. It exactly wasn't pinned down where it started, but it was a kind of a combination of breakouts all around the world, mostly through avian origin. And so quickly it spread throughout the entire US, and the first measures that were taken to control the actual influenza was social distancing, isolation, no more public gatherings, closings of schools, and other measures. The bottom picture and the top picture with the nurses and the hospitals show the overflow of people being affected. So overall, 1/3 of the world population was affected by this influenza. There were no vaccines or antibiotics at the time to treat it, so it was mostly just through the measures taken in society. On the top right picture where it says 500 million, that was the amount of deaths that were registered, and even more so that were 500 million affected and 50 million deaths. I'm sorry. The center bottom picture, that is from Twilight, Edward Bean. He died from Spanish influenza, just a fun fact. He didn't die, he was turned. Anyways. And the other picture where it says masks are a joke, that was also a problem that was faced at the time where people didn't want to follow social protocols with trying to control the breakout, but yeah.
There's like an anti-mask league of San Francisco. It's like a whole association.
Yes.
Yeah.
And yeah, eventually through the pharmaceutical interventions taken, it kind of disappeared in 1920.
Hi guys, my name is Nate. We have a few ideas up there. They all relate to unethical experiments though. So one of them we talked about was the Stanford Prison experiment. Just a quick brief thing on that. You basically have a group of subjects who are split up into 2 separate groups, one of prisoners and one of like police guards. The prisoners are given no information, but the police guards, they are told basically to treat the other subjects like they're prisoners and don't let them know what's happening. So they would continue to beat them and torture them. And this experiment lasted for 6 days. And what we learned is that the prisoner subjects began to basically go mentally insane and think they were prisoners. So after that, we, for some reason, have a picture of a teddy bear with smallpox on there. I'm not really sure what that is. One of the other ones we talked about was the EPA. So the EPA was created in about 1970, which our group thought was kind of late. We didn't really know that was a thing because people back then didn't really have care for their environment. So that was an important one. And one more, I'm missing one. What was it?
The Occupational Safety Health Administration thing was passed by Congress in I think like early 70s. Exactly when, but yeah.
The teddy bear, just for more context, smallpox was like declared eradicated by the World Health Organization, and I didn't want to show any images something like people with smallpox, shake a teddy bear.
Thanks, Adam.
Yeah. Right, you're fine.
Hi folks, okay, my name is Maria, my pronouns are she, her, first, and we decided to talk about the HIV/AIDS epidemic. So what that stands for, if you don't know, is the human immunodeficiency virus, which is a retrovirus, and then we have the acquired immunodeficiency syndrome, which is going to be the AIDS. So we actually really focused a lot on like the stigma behind it and how particularly like the LGBTQI and like Black community were especially like ostracized during this like time period. So then I'm gonna pass it on to my other group members to talk about the importance of like language, changing language to fight stigma, and then about what SAW does.
So my name is Madison. As Maria was saying, during this time period, there was a lot of harmful language that was used, mainly just due to ignorance. So through education, we're able to change that stigma and inform people on the correct ways to speak to patients with HIV and AIDS, and just be more conscious in the verbiage we use. So additionally, through education, we can also prevent the spread of HIV and AIDS and help those who do have HIV or AIDS to seek help.
Yeah, and if you could do the next slide. Yeah, so then these are two organizations that are you can find locally to Cincinnati that provide services. So not just healthcare, but also like educational efforts, as we've talked about.
Okay, so I'm going to tell you guys a little bit about SAW. So unfortunately, my picture did not make it. I think I'm getting too late. But so a big part of what SAW does is to reduce the stigma and empower people with HIV. And so one program that they have is called Healthcare House. And what Healthcare House does is like it provides a safe place for people with HIV to come in. And it is actually the only center in Mesa too that provides these antiretroviral treatments for HIV. And in addition, just like going off, they also have income generation where it like provides people with HIV to feel like that they're functional members of society, and they make all these items that we actually do sell. And yeah, that's just a little bit about what they do. There's also CHOP workshops, which is for prevention, and then they also talk about a lot of topics that are kind of like considered taboo. But yeah, that's just a little breakdown of SAW.
Yeah, thank you.
Yeah, so I'm Neil. We looked at the opioid crisis, which primarily stemmed from physicians, institutions, and hospitals prescribing or overprescribing pain medication. And so that resulted in an addiction crisis that affected a lot of people in our community and the US in general.
And so this slide, we kind of just looked at the different ways the community is trying to treat addiction in general. So the first top two is like we have things like needle exchange programs. So this is like obviously with the heroin addiction, that maybe opioids maybe was a gateway drug to more other drugs. And so things like needle exchange where they would trade in the old needles with safer needles, and that way they're not transmitting diseases through that. And then as well as like counseling, mental health has obviously been a huge benefit for like obviously gotten a lot more mental health and addiction counseling.
So bottom right is new technologies. So there's different ways to treat pain. Also, sorry, my name is Jonathan. I said the Norman, I forgot to uphold it. So just as a little plug, the company that I'm co-oping at has developed a cryo nerve block therapy, which is just really cool. So then during a surgery, they will freeze a nerve in your thoracic cavity, and it will degenerate, but then heal itself over 3 to 6 months. And so then post-operation, the patient feels no pain at the site of the surgery, but you don't require opioids, or you require much less strong pain medication so that people aren't getting addicted to stuff like this, which I just thought was cool. And then at the bottom left here, we have Narcan and naloxone. So those are nasal spray based treatments for overdoses. And so there was a cool stat that we found that from 1996 to 2014, over 26,000 cases of accidental opioid overdose were reversed by non-medical personnel. So that's just people who had access to naloxone, were able to treat someone going into overdose because of the easy usability of this drug and how widely available it is.
Great job, everyone. That was very educational. Thanks for talking about all these things. You guys had like a bit of like fun and learned a lot while doing these presentations. So we just have one more slide left. And it's something we always like to do in our internal GHUs, which is give a couple of positive outcomes. So regarding public health, we've made like massive strides ensuring that the people around the world live longer and healthier lives. Stuff like death rates and infant mortality have like drastically dropped, while life expectancy has like risen a bunch in the past couple decades and centuries. And the development of vaccines has made many viral illnesses obsolete. And that combined with like widespread antibiotic use also has made a bunch of things, a bunch of communicable diseases way less common in the world. And another good point is that like our research network and like the advances of modern medicine is expansive and growing. I mean, we made a vaccine to like a massive pandemic in a year. That's super impressive. But of course, there are still areas of the world that don't have equal access to public health services. But hopefully with organizations like us, WellMed, we'll be able to build like a healthier world for everyone.
Yeah, and with that, we're going to move on to our collective breath to close up the meeting. So as always, does anyone have a quote or anything that they'd like to share with the class that they found inspiring or anything?
It's a mountain to be on mountains quote. I put it up earlier because not the point. The point is this book of not to be on mountains. Okay, I'm gonna say my quote. It's a quote from the book.
What was the book again?
Mountains beyond mountains.
Okay.
You missed them?
Got it.
Okay. We should all be criticizing the excesses of the powerful if we can demonstrate so readily that the excesses hurt the poor and vulnerable. About social choice policy also performance relevant to today's GHU. And then the other part about it, the other quote's like, he asks, are you incapable of complexity? Just something to think about. Maybe not the most like uplifting, but definitely thought-provoking.
Thought-provoking indeed.
Awesome. To follow that up,
One that is kind of sort of related to why we're all here in this room. And it's from Lorax. I don't know if you guys read the book or seen the movie. But unless someone like you cares a whole awful lot, nothing is going to get better. That's why it's really important that we're all here, because we do care an awful lot. That's the reason we take time out of our day, of our week to come and do something like this. So thank you, all of you guys, for being here.
Awesome. Good one. And with that, I'll breathe to doing good. So go ahead and stop your gaze or close your eyes, whatever you want to do. Take a deep breath in. Deep breath out. Excellent. It's like we're all here together. So with that, we just have a few little announcements. So next week we're going to be doing another partnerships presentation. So look forward to that. Again, so you on our YouTube channel. Hopefully, as long as it works well. So if you want to be censored, I know your voice censored, let us know. Still doing contact with co-presidents. You guys know where that Google form is. I feel like we're just like sending out every email, like a signature. And next week we will be sending out the committee form. So that's the big thing. If you want to get more involved with GlowMed, committee forms coming out next week after our chapter. So with that.
I just wanted to say that we have a GlowMed fundraiser at Chipotle on Tuesday. All you have to do is show them like the flyer that we have that we're going to post on our Instagram, and they sent it in the email. But yeah,
We'll send
it's
it again.
from 5, yeah, from 5 to 9.
Tuesday 5 to 9. Go to Chipotle. Bring your friends.
Sorry. Another quick detail to add about this Chipotle fundraiser is that if you're doing an online order, there's a code you can do at checkout that gives you the same discount for us. So if you're farther away or you're door dashing it or something like that, on that flyer, there's a code that you can use to get that discount. You don't actually have to go into the Chipotle. So it's also very nice and convenient. And if you're gonna order it, door dash it, whatever you like, be sure to use that code as well.
Oh, yeah, it's the one South Campus. It's on McMillan. It's not the Stetson one. So, Neil, you can walk a little extra. What's up,
Yeah,
Maria?
so we are gonna send that information in the group. So if you're not in the group, like, come bug me or G or Nella and we'll add you to that.
Or literally anyone can add you to the group. So,
Yeah.
person beside you.
Do that too. But yeah, just a reminder, like all of the profits, or not all of the profits, but like all the money that we are making from this fundraiser is gonna go to our partner organization, SAW. So we're not gonna be using that to like buy t-shirts. It's going directly to SAW.
Excellent. Does anyone have anything they'd like to say to the mic before we split up? Okay, then, thank you all for coming to Blue Man. We're gonna go start our meeting now. Feel free. More call, have fun. Or don't have fun, so please come and see us this week.